Hi, I'm Dr. Christopher Barker. Welcome to Holding Space. We have a guest today. This is Michael Scarano. You've had quite a varied experience. You've been physical therapy assistant, chiropractor, medical doctor. And with all that background, you've come to an interesting concept that I'm really interested in hearing more about, toxic perseverance. But if you want to tell us a little bit more about yourself before we get to that.
Well, ADHD has always been labeled as a disability, and I look at it as a kind of a superpower. I think my background is a journey, been through a lot of different things, disciplines, careers. I don't put in there that I was a mortgage banker for my father and real estate broker as well back in the early days. So yeah, I now am pursuing what I'm doing with toxic perseverance. I left healthcare in 2015 happily. It was quite a grind. It was a lot of fun. I really enjoyed treating people. I specifically worked in the area of chronic pain, musculoskeletal pain specifically, non-cancerous, non-surgical, meaning surgery couldn't help the pain, but I treated a lot of post-surgical patients. And yeah, I in the last couple of years, been developing this topic that I'm quite passionate about. I'm nearly finished with my book. I'm finishing up the ending. Uh, your hearers will, I'm not sure, be frustrated or glad to know I do not have the answer for the subconscious mindset. I'm going to leave my book with a lot of tension. I hope people have good tension when they finish reading it, because
This is always
truthfully, Doc, I'm going through it, and I am the month over month the concept deepens and makes even more sense to me. I mean, I did the TED talk. I did it in January, and it just went live last month. And since January, it's matured, and I feel really good about being able to hopefully interrupt people's subconscious with a conscious understanding of who they are. That's my ultimate goal. That's it.
that's
I'm
that's
not a
great.
Tony Robbins or a Gabor Mate or any of these other gurus out there. I'm just me, and I'm going through life with a bunch of knowledge in my head and feelings in my heart, and I'm going to share it with the world, and someone will listen, I guess.
From those diverse experiences, we gain insights, we gain awareness of things, and we bring all that experience to the things that we wind up sharing with other people. I myself have some complex trauma in my background, and I've worked with a lot of people who have it. Some people with PTSD, some people with complex trauma, which is more about what you don't get than what you do get, in terms of attachment and that sort of thing. But my book will be coming out pretty soon too, and I just finished not so long ago. So I guess it'll be a race to the bookstores. And we'll see. We'll buy each other's books and meet
Yes,
up.
looking forward to it.
Yeah. But
I
so
you, go
what
ahead.
is toxic perseverance?
Well, broadly speaking, it is the subconscious pattern of thinking that takes root in our bodies. And I say bodies purposefully because it's not just a brain thing. Takes root in our body after some kind of trauma. It can be death by a thousand cuts or something very specific. Trauma comes in all shapes and sizes, you know better than me. But what happens to us as human beings, I believe, we fear addressing it. As much as our brains love balance, we do suppress things. And when things get seated in that subconscious, traits, behaviors, thoughts develop as both a protective mechanism and as potentially a harmful result of the unprocessed trauma. So we have this trauma, we don't process it, we develop traits, thoughts, feelings, and beliefs, and then eventually leakage happens. Those traits, shame, fear, guilt, as I like to say, the big three, but other traits that are involved in our daily lives, such as worry, anger, pride, perfectionism, low self confidence, gossip, overworking. overthinking, perfectionism, the
Yeah.
so-called imposter syndrome. Those traits start to now become the emotional architecture of our very drive. So we persevere in life, but we're persevering through the lens of an unhealed subconscious.
I
That's
love
the
that.
basics of it. And what I've noticed in my own journey over the last couple of years since I had a huge trauma happen was I decided to first and foremost sit down and literally talk to myself about all of the things that have happened in my life, bad and good, and take a self assessment through a lens of grace rather than harsh judgment. And before these last 2 years, there was no one on the planet that was a bigger critic than me. If I did something that was hurtful towards someone, I couldn't apologize enough and then talk badly about myself enough. People didn't have to criticize me. I did that already. So I got into this loop of I call it the shame, anger, loss of meaning loop. I've developed several of these loops in my thinking around the overall toxic persevering loop. And I'll explain that in a minute. But since shame became my go to, if you will, I developed some incredibly self destructive thoughts and behaviors over my life. And when my dear friend of almost 44 years killed himself, this was 2 years ago. This is what started all this. In
Mm.
January of 24, he did that, and I went into this whatever you wanna call it, real spiritual, cathartic mindset discovery and transformation because his that event rocked me to my core. And so I've come up with this toxic perseverance. It came to me. I don't claim this is even close to a Nobel Prize because the work in the trauma field is so extensive. And I am by far a trauma expert, never will be. But I do think that the idea that I've come up with is a way to look at this issue from a very human perspective.
Yeah.
So I hope that I'm not sure I wasn't too convoluted.
No, no, I think that was very clear. I'm sorry for your loss. I know sometimes a profound loss like that can really have a deep effect on us. Being able to get hold of it and say, what's going on here? And is there some way I can sort of make lemonade out of this in a way of like conceptualizing it and understanding? And because you're right. I mean, the things that leak out in your subconscious are sometimes we have no idea why we're doing the things we're doing. And that just leads us down a path of, further maladaptive behaviors, maladaptive personality characteristics. We adapt, but, sometimes that adaptation is not productive. So I love the concept. And I mean, it's a different lens of looking at, what happens after trauma, much as my stuff is.
Mhm.
I'm not really saying anything that hasn't been said before, but I'm, again, trying to look at it through a slightly different perspective of integrating, body and mind. And that's, I think we need to sort of like, it's part of our own healing, but it's also to promote others' healing because
Yeah,
I can easily see what you're talking about in a lot of other people too.
for sure. For I see it all now. I see it in my children, my mother, my brother. It's a we all have a subconscious and we all have a past. And as much as I'd like to think I'm a great dad, I know I did things that was hurtful to my children. And there isn't a close second to someone on the planet that I love and cherish more than those three. And here I am hurting them. Here I am behaving in ways that was made them feel uneasy or unsafe or, just not totally they feel not totally loved, and I did that, but it wasn't me. And I can't say that to them. I can just say, "Okay, that was your subconscious. That was the trauma stuff coming out," without ever really dealing with it. I went to therapy for 8 years, and I lied to my therapist. So how effective could he be? And most patients, unfortunately, lie because at the root of this is this fear of really facing yourself. And And now that I've done that work, Doc, I think I want everybody to do it because as hard as it is not equally. It is more than satisfying and gratifying and uplifting and than staying stuck. And I was stuck for 56 years and I'll be 58 in a couple days. And I'm too old and I'm too tired to carry this stuff anymore. Right. I just need to lay it down. Now, if I can only get that message across to, say, my 28-year-old, what what a life any of my children not carrying toxic perseverance that they could have. That would be so much more fulfilling and positive. And I just wish I know what I know now. I get as we age, we become more wise. But when I look at the adolescent population, my children are in their teens and I have one that's almost 30. But when I look at the adolescent population and I see all that pain, I am very nervous for our country's future. I don't mean to broaden this so much, but I do see now my perseverance in life, while it made me somewhat successful, on addressing not addressing that trauma, not addressing myself, not even bothering to really get to know who I am, was incredibly hurtful. It was harmful to my life.
Yeah.
And I have contemplated ending my life. Not in a very serious way, but the thoughts come like, is it better off if I'm just not here? That kind of a thing. Not like I'm making a plan,
Right.
but when my dear friend did it, the reason why it was such a wake up call is because I didn't idolize him, but I valued him so much. He was the most incredibly he was the most I say this all the time. I think I said it in my TED talk. He was the most charismatic man without an ounce of charisma. He just had a way. Everybody didn't like him. Everybody loved him. How could he end up in this spot? Now, I obviously don't know all of the inner workings of my friend. I don't know all of the trauma that he had as a child. I know a lot of it, but not all of it. I
Mhm.
certainly don't know how he processed it. And I'm also not saying that understanding toxic perseverance is a cure for suicide. No, that's not what I'm saying. I am saying that to get outside of psychotic bipolar depression, where there's real chemical issues, I'm not talking about that. I'm talking about not that. My
Right.
friend was not that. Um, he lost all of his hope. And when I watch and I go down his life trajectory, I go, okay, there it was. That
Yeah.
that that was such a significant event in his life, losing his mother tragically when he was 37. He never recovered from that, and I didn't pay attention to it. Why didn't I pay attention to it? The exact reason why I call it toxic perseverance, because he was so successful and he was happy and he made everybody else feel good. So why would I question that he didn't get over the death of his mother? That's silly.
Absolutely.
You know what I mean? It's like
Yes.
that's the strong ones sometimes you need to check in on. And even when you do, you're never going to get the right answer because they're going to just stay strong.
Yeah.
Especially us men, right? We're just blockheads. We just push
Yes.
it down. We're not gonna admit vulnerability. Oh my gosh, that's so weak.
And it actually takes a lot of strength to admit vulnerability, but it also opens you up to the gates that open when you let something out. Also, the fear is that something's going to come in other words, you're going to feel worse by being able to say something about it. Sometimes it's better we tell ourselves to just keep it under wraps and not think about it. But not thinking about it really doesn't get us anywhere. And you're right. A lot of people do go into therapy with like one aspect of a problem and that's all they talk about. And we don't get to hear everything. People ask me all the time, like, well, can't you figure out everything that's going on with me? Well, no, I only know what you tell me. So,
Exactly.
and if you don't tell me everything, then I don't understand everything. But
Exactly.
I have been trained in like psychodynamic theory, so I do understand the role of the subconscious. And yeah, it's always working. It never takes a break. It's working when we're dreaming, it's working when we're doing things. And
Yeah.
although we tend to think of perseverance as, one of those good qualities that we're supposed to have, if you're persevering in a dark path, it's not good. So
Exactly.
yeah,
And
I get
right,
it.
isn't that the sort of the nuance here of what the message I bring is? the mechanisms that you create and learn to survive, to persevere, work until they don't. And I think that's why a lot of people may listen to this message and blow it off because they're not really considering that subconscious drive, and they're not honestly and vulnerably facing that reality. And I love my brother to death. He is not comfortable facing the past. So what did he do? He worked 40 years, 12 days a week, and 32 hours a day. The man grew up with his cell phone next to his ear. I actually do something for his beautiful daughters. I do impersonations of my brother, and I just hold the phone to my ear and I just go, "I'll be right there." And when I did that for them, one of the girls said, "Uncle Michael, that's my whole childhood." So, but if you talk with my brother, he's an incredibly kind guy. He'll ask you questions. He'll very reluctantly offer advice. He has a great balance when he speaks to you, but he does what every other man that I know does, like my dear friend Fotis. "So, how are you doing?" "I'm good."
The
"Okay."
default answer. Yes.
Right. And I'm not saying women don't do that. I'm not a woman, but I know guys do. And I know I do. "How you doing?" "All right. I'm good. It's all good. No
Yeah.
worries."
Yeah, that's what we're conditioned to say. What advice do you have for therapists who might be dealing with knowing that there's something underneath? You get an inkling and then you pursue it. How would you go about pursuing something like this in a therapy setting?
Well, I mean, obviously, I'm not a therapist, so I don't know what your rules are. But a dear friend of mine currently is I've known him for a better part of almost 20 years now. Actually, it is 20 years. He's a psychiatrist and he's insanely talented. And his best talent is his vulnerability in the room. You know, there's this, I believe, unwritten rule or written rule that therapists aren't supposed to share their walk, their struggle. I think that's a mistake. I think I'm not saying a therapist has to bear all, but what I have found, generally speaking, with therapists is they never offer their story, not even a piece of it. So it
Mm,
almost becomes this unequal relationship. Now, obviously, the therapist has authority and power by virtue of their license and their standing. I get that. I loved my therapist. He's a great guy. He was a so-called specialist in ADHD. But ADHD wasn't my problem. It was my damn subconscious. And we never got there because I could manipulate the conversation.
yeah.
But if he had only said, sometimes I just feel like, I don't know, whatever, and shared something with me, it humanizes the therapist. So, as I say to when I had my practice, if you, as like a front desk person, every person that walks into this office is hurting. If you greet them with anything but a smile and a warm hello, I will fire you. People need to feel safe and people need to feel validated. And sometimes I think therapists can be very validating if they would just share a little bit of a struggle they had and how they worked through it. I think that would offer the client a lot of room to get deeper in their vulnerability. Right?
Yeah.
It's still, even though generally speaking, therapists are soft spoken, I can tell you're very disarming, you're soft spoken. People still don't want to face it. And I think I got more out of my patients that were in physical pain. I think I got more out of them emotionally because of their physical pain than therapists may get emotionally out of them because of their so called emotional pain. I don't
Yeah.
think they're separate. The only place where the physical and the mind are separated is medical school. They are terrible at linking the two. Now, I went to medical school 25 years ago. Maybe it's changed, but psychiatry is way off in this abstract abyss. And nobody wanted to go into psychiatry. You're a fool if you go into psychiatry. Yet some of the psychiatrists I've known, my friend and my uncle, are probably the brightest human beings I've ever known in my life and the most
Yeah.
insightful and caring. And the mind body connection is absolutely real. And I wish it were integrated better in medical schools. That and nutrition, those are the two big areas where medical schools fail. And I
Yeah.
mean, big fat here, F. I don't know how to do an F. Um, s- s- so I'm not sure why I got on that tangent, but my advice, I guess, to therapists is be more human, be a little bit vulnerable with your patients appropriately. And my guess is you'll get deeper with them. But
I
what do
think
I
you're
know?
right. And I supervise interns and they call themselves baby therapists, but a lot of people who are before they get to their highest licensure level. And they say, well, gee, they told us in school not to talk about ourselves at all. I have found, I mean, we know from research that the biggest factor in cure, if you want to call it that, is the therapeutic relationship. Being able to find a working bond and feeling connected to that person. We talk about engagement. If client goes home and says, I tried that thing that you told me about, that's engagement. That shows that they are, working with you. But I don't think you can get that if you're just sitting there listening. And you're absolutely right. I think being able to say, yeah. Oh man, I get that because I've had that too. It sometimes you get such a loosening reaction from people. It's like, oh, you have? Really? What did you do?
Yes.
And when something like that happens, it's a moment and those
Yeah.
things are really
And I
valuable.
and I would recommend that the therapist has things prepared that they can say that are not too hard. Like, my God, if a female therapist is talking to a female who is sexually abused and the therapist was also, probably don't want to bring that up.
Yeah.
But you know what I mean? Like, I think you can preemptively think of, I think I can share that argument I had with my husband or something. Again, I'm thinking out of the box right now or just
Yeah.
off the top of my head, but I think we're saying the same thing, that humanizing yourself. And, I do, I guess, coaching now. It's just such a saturated charlatan field. But, what's the difference between therapy and coaching? Well, this is what the coaching people will tell you the difference is. Therapy goes back to the beginning, and coaching goes from where you are today forward. And both are flawed, I think. Sometimes going back to the beginning keeps you there. And a very skilled therapist can draw people forward. But
Yeah.
as you know, there's a lot of not so skilled people in the field, and same in my field. And a coach, if they're just taking the person from today and they're not addressing anything from the past, then okay, how effective will how lasting will your coaching be for that person if they have all these landmines that they haven't even reconciled? So I think the benefit of having my status, if you will, and this is not at all a plug, this is just, and that's why I say to you, when I treated patients and I was about to shove a needle in them, there's a trust there implied. I could share anything with them because I didn't have this unstated emotional connection to them. I would tell patients things that I struggled with to lower their temperature and get them to open up more. Because
Right.
yes, they needed the needle, but they needed much more. So I think coaches can do that too. And I think therapists are in the perfect position to do that if they would just humanize themselves more. So
Yeah. No, you're
beating
right.
the dead horse.
I think that's something that we pick up with experience, and that is one of the things that I try to tell the new therapists that I'm working with is that relax, be yourself, and be able to, you don't want to make it all about you, obviously, but you do want to be able to at least empathize and make statements that indicate that you really get it. And that's more than just
Yeah,
reflective listening. It's also being able to humanize the whole process from both sides. So yeah, I'm totally with you on
yeah.
that. I think it's a good way to go about it.
Mm.
I really enjoyed hearing your perspective. I, feel free to come back after your book is published and let us know how it's going over. As if you have any links for anything that you do or TED Talks and that sort of thing, we'll be glad to put them in the comments. And people,
That'd be
please
great.
feel free to leave comments and questions. We get back and answer them as quickly as we can. And if you have anything else that you want to see, please like and subscribe, as they say. But
Absolutely.
it's been really great having you here, and I really enjoy your perspective, and I think you have a lot of important things to say.
Well, I
I hope this,
appreciate it,
yeah,
Dr. Barker. I appreciate your time and what you're doing. It's important. I've heard the statement. What is it? There's a lot of people out there that are hurting, and I say, and are there any that aren't? I'm sorry, what?
it's
Yeah.
a matter of degree.
So it's
Yeah,
important to
yeah,
keep
it's a
pushing
matter
this
of
message
degree of
out, my
hurting.
friend. Thank you so much. Yeah,
Thank you. It was
but
so glad
thank
to
you
have you here.
very much.
Take care,
Yeah, take
and
care.
thanks for
Bye bye.
holding space for us.